Despite the advice from Hippocrates nearly 2,500 years ago to let food be thy medicine, in the last 50 years we seem to have turned increasingly towards pharmaceutical drugs in our quest for health. From a quick Google search, I found a very interesting number. In 2012, over 1 billion prescription items were dispensed in England. That's 1,900 a minute. I'm sure we'd all like a better alternative to this and be able to ditch all those drugs. So how far can a healthy diet really take us towards this? And I wondered, Emily, as a nutritionist, whether you'd like to start us off on this one.
Is this working? Yeah. Yeah, I think we're in a complete bit of a crisis of where we're at the minute. And I think a lot of drugs are, particularly, and what Aseem probably speak on, is the statins. A lot of those kind of medications are so overprescribed at the minute. And we've really, really moved away from this aspect of whole foods and how a healthy diet can actually help that. Now, if you speak to a lot of doctors in particular, and I studied my master's in obesity science, and one thing that actually came out from that was how many doctors just did not believe that food had any impact at all. They just thought obesity was just about gluttony and just energy in equals energy out, nothing at all to do with the types of calories that basically people are eating. So I think that, and it's trickled down as well, and even when I look at when I was at university so many years ago, and I always remember one lecture that we had with a dietitian, and it was a therapeutics dietetics class that we had. And even a dietitian at the time even said that as long as a person was having a 600 calorie a day surplus, so as long as they were just eating less calories, she didn't care how they made up their calories. And this was actually us sitting in a lecture for us to go out into the world. And she said her exact words were, as long as they ate, they could eat bread all day if they wanted to. As long as they hit their 1,200, 1,500 calorie level, that's all they cared about. So, and that's coming at people who are meant to be the healthcare providers, nutritionists and dietitian level. And I see that and have many a fight with many of my colleagues within that profession. So I think we are definitely so far away from it. I think we're making kind of the tipping point, I think, is coming, so particularly with things like sugar. And that's becoming a lot more aware now. I think that's obviously the starting point with it. Fat, obviously I completely come from a training of, it was always about low fat, and I actually apologise to people in the beginning when I first started practicing, because I was all about advocating the eat well plate and the low fat diet, and completely apologise to anybody who I gave that advice to back in the day. But unfortunately, that is what we're getting studied and trained upon. So I think really what I would like to see with it as well is it being changed at that kind of degree level and university level. And even when you look at the way doctors are trained in nutrition as well, I mean, they get something like 2 weeks out of their whole degree training on nutrition. Or if that even. So these guys can probably comment on that a little bit more. But I think it is definitely coming, and I think I think it's going to come from a lot of just people out in kind of the world. And Tim Noakes, I don't know if anyone knows kind of Tim Noakes is in South Africa, but he's got a really good saying is that it's changing one person, one meal at a time, and that's going to be the masses. So it's going to have to come a lot more from the people and the general public that's really then going to let more of the health professionals sit up and listen with it.